in terms of partnership working, there maybe needs to be like a big deep breath, a step back, and looking at some of the basics. Because I think today, while I've been here, I've been thinking, what's bothering me about this? And I think it's because there's some really basic things that need to be in place for everybody to be included. So, for example, I'm just going to pick up on one thing that you said about health and about the model, medical model or social model. For what it's worth, can I put a vote in for the social model, because it takes a barriers, sort of barriers approach, social barriers approach. So you look at the situation, what's going to prevent people taking an active part in this? So just one little example, NHS, Ayrshire and Arran, within audiology, if you go into the hospitals, the main reception desk has a loop system, if you're a hearing aid wearer. The audiology reception has a loop system, brilliant. The consultation rooms don't. So how can people be active participants in their healthcare if their access requirements aren't met? And similarly, for visually impaired people, they continue to be communicated with, through standard print letters, even although, like say, the ophthalmic department may know that someone either has very restricted or no sight, they continue to communicate in an inaccessible format. So until really basic things like that are addressed and people can contact by text or through a text phone, how can people be active and equal participants in any of this inclusion without basic things being met?
No, I absolutely agree with everything. Just for the avoidance of all doubt, the Alliance and virtually all our members vote for the social care model as well. I think the point I was making before I get to your access point, the point I was making is that there is a challenge. That is a challenge, and it's less of a challenge as you move from the hospital sector into primary care, and as you get community-facing teams. But the closer you get to a hospital, the more a social model, a medical model prevails. So there's a big lesson. There are a whole series of lessons there to learn. The access issue is pathetic. That's the truth of it. I remember. I'm old enough to remember all the access legislation, and I'm talking about physical disability. I'm talking about my son when he was wee, and we still don't have anything like appropriate physical access for people with disabilities either in the main, and we have patchy, as you say, we have patchy support for people who have hearing loss or visual impairment. Sadly, I sit in the Ayrshire and Arran Health Board, so I'm partly responsible for that. But you can rest assured I'll be raising it with the Chief Exec when I go back.
Certainly access is a major issue that comes up when we're talking to older people through disability or whatever. But one of the biggest barriers to engagement of older people is those older people who are isolated. There's no social contact with them. They don't necessarily have any family. And it's how we reach those people so that we can get a real picture of what the barriers are to improving their quality of life, which includes the quality of their healthcare when needed.
Yeah. One of the aims for Scottish Government, and it's an honourable aim, is that care will be delivered in homely settings. And that's loads of older people will want that. Equally, however, there's loneliness is a major, in the mental health challenges that go with that, a major epidemic amongst older, isolated people. And there are a few initiatives around there, some that are as old as the hills itself, lunch clubs, dementia cafes are a thing for people with dementia, but there's no doubt that that's an issue that we're going to have to address because the proportion of older isolated people has been rising very, very significantly. I don't have an easy answer for it, but there needs to be a local answer to that one, in my view.
Yes, Ian, I was just wanting to make a couple of comments. Talked earlier on about all these different streams of activity that are on, and I'm very aware, as someone working in the public sector, you see activity around health and social care, the joint improvement team work that's going on, but also just in terms of economic development, there's work around social enterprise development, and we're working in an asset-based model in community development in neighbourhoods, and you mentioned that earlier. It's just about how we join up these streams of activity, and I think there's a big challenge there, but probably the answer, or part of the answer, is how we communicate with communities, and sometimes I think, are we asking the right questions? And a lot of the time we devote a lot of our energy and resources through existing groups, and this is in no way critical of groups like community councils or other community bodies, but it's reaching the larger population. That's always a challenge. And if I was to add another question to the list of 3 questions that you posed earlier, it would be this. What do you care enough about to want to do something about it? I think that's the key. It's about how we get people involved, and actually we're maybe saying the wrong things or asking the wrong questions. Because I think when you do scratch the surface in communities, you uncover a lot of passionate people, a lot of people that really care about the people they live with, and their neighbours, etc. But we're just asking the wrong questions and maybe in the wrong context.
Gus, yeah, I promise you I wouldn't raise this, but and I wasn't going to say this, but of course I care about Prestwick Steeple right now, right? I come from Prestwick, and our steeple and buildings in Prestwick are there, and I'm getting increasingly vexed about it. And within myself, I'm getting increasingly vexed about it. But that business about asking people what they care about, we've got 2 things working locally that I'm involved in. The academy that Phil mentioned, and Phil will be testament to this. And we've now got a whole army of volunteers around that. People who care about exercise, about sport, about disability, about mental health. And I'm involved in the Gaiety, and we've got loads of people there who are interested in the arts. And I know there's a huge army of befrienders and other people who are interested in early response around care and older people. And we need to be mobilising that, in my view. Now, at the end of the day, we're always going to have, we live in a nuanced society. Community councils are statutory organisations. You go to them for statutory consultation. Very often they're self-selecting, well-meaning people, but you don't get to the voice. In hostels, you'll have patient groups that are quite narrow. That's the nature of the game here. But it is getting into those spaces, those black holes, that's going to be the trick here. And I wasn't kidding on when I said the art of community development, which got kind of obliterated at some point over the last 20 years, a lost and valuable art needs to be resurrected, in my view, to make that happen.
It's really just around that the emphasis on rights, because I think sometimes it's a kind of bit of a turn-off for folk when they mention the kind of rights-based thing. But to me, it's incredibly powerful. I know there's a kind of think piece that you produced, your organisation produced, but is there any kind of hope that that might be able to be taken more seriously in the kind of legislative, as the bill goes through, that's actually more to the fore? Because I think it addresses the person's point there around access. That's a human rights issue.
Phil, thanks for that advert. That's the piece that Phil was mentioning. It's called Being Human, and it's a think piece we've got out in human rights. We also have a partner think piece on health and social care integration, which is called Transformation and Integration. And we also, just so you know, have I'll get to your point in a minute, we also have a newsletter called Engage and Inspire, which, if any of you are, which the third sector interfaces will get routinely. We're at newsletter 15, I think, and VASA are part of the governance group for the team that we've got. It's called Engage and Inspire. But I guess the issue is we do have earnest success. We've had very successful discussions with the bill team about putting human rights in the face of the bill, and certainly it will be in the guidance and implementation in the Act. And you're quite right to caution as people get into legalese here. This is much more about working practices locally, and if it goes into the bill, it will reinforce stuff that's in the Scotland Act itself around human rights for individuals.